Okay, so that just brings us to the last piece of the day, which is concluding remarks. So I'm just going to attempt to just maybe recap what we went through today. And so it's a good test to see if I was listening at all. So the whole point of the day is to look towards a refreshed national care strategy. And so we kicked off the day, and this was followed by Liam, who looked at the past, the present, the future of family care research and policy in Ireland, and he was talking about, the implementation challenges that are faced. He looked at the drivers of family care policy, and he brought us right up to the National Care Strategy in 2012, and it'd be interesting now how we move forward with the health and social care policy, but as Liam said, it's important that we all try to keep the carers' voice at the forefront in that policy. We then heard from Ronan Foley, who is the geographer, and gives a fantastic presentation of the census data that's out there and the amount of information that's out there that can be mapped out on carers. And what he was really saying is where you live matters. And so he mapped it out over a 10-14 year period and looked at different intermediate level and cluster maps. Then we heard from Dr. Nikki Dunn, and Nikki talked about the physical, the mental and psychological impact of caring, and over a 10-year period. And really what we find is that hasn't been a lot of improvement. Carers are still struggling with their physical and mental health, and financially as well, one decade on. Nikki then making recommendations to support carers to be healthy. Following that, then we heard from Emma and the work being done across the water in the University of Strathclyde. Emma was looking at outcomes for carers, and really what Emma was saying is that we really need to drill down those outcomes. What are those personal outcomes to carers? It's not just about looking at their well-being, but what aspects of their well-being do we need to look at? And she proposed different models there and discussed the complexities of the systems. And she used the lovely metaphor of the lily pod and using that to get over a certain period of time, or getting over that river. And then just before lunch we heard from Laura and Aisling, and Laura and Aisling talked about carers' resilience. And Laura said the carers felt more informed and more supported when the care recipient that they engaged with was receiving hospice care than long-term residential care. She noted that the National Care Strategy 2012 focused on the community, but just because your relative is in long-term care does not mean that you're no longer a carer, and that person still needs the supports and the policy to underpin sort of the supports and services they require. And then that brought us to lunch, and we had a couple of speakers after lunch. The first was Mary Cronin. The first was Deborah actually after lunch today. I forgot to mention Aisling, of course, and her very moving story of her care work for her father, and also how she continues to care with her mother with dementia as well. And I think it's really important that we actually hear family care's own real experiences. As we said, that is the realities, and you can do as much research, as much policy development you want, but drilling it down, the care's experience is most important. So, and I loved Anya's people who are willing but not available to help. I love that. So then we heard from. Now there was a bit of a change in the program, so I'm getting confused a little bit now. So we heard from Mary Cronin, Mary spoke about promoting a think care approach, and I think if more policy developers and policy influencers adopted that think care approach, then they keep carers at the forefront and they would get the supports and services that they require. We heard from Deborah then, who talked about educational exclusion of mothers and children. She presents a very robust piece of research with interviews and a survey of parents with intellectual disabilities, of children with intellectual disabilities and developmental disabilities, and talked about the impact that has on the children and on the parents. And she talked about the home trap for parents and mothers, and the carers' rights to work, and not only to work but also get time off to attend their children's appointments. Now, I think that was everything up until my colleague Dominique. She spoke around how carers have had to change the way they work or alter their work arrangements to accommodate their caregiving responsibilities. And, you know, while there can be some challenges balance work with care, working and while providing care can bring many benefits for carers. It's respite often away from their caregiving responsibilities. And then we had a very energetic presentation from Audrey at the very end, which was great to kind of finish up the day, and really the importance of looking at supporting carers, young carers in the school. You know, often if young carers are caring for a parent at home, often they have to be the adult. So youth services like us here and models like us here are a great way of allowing those young carers a little space and security. And I often think, like, young people of today, we have to sort of, you know, not prime them, but they're the ones going to be caring for us when we're elderly or when we need care. So that kind of encapsulates the day. I think it's very clear that the diversity of the research, the richness of the research and practice that's going on, I think was very evident from the papers today. And I think, you know, what today is said, and I think Rosemary said this earlier, that, you know, research does really have, and practice has a role to play in informing and developing policy that relates to family carers, and we have to ensure that family carers' voice is, you know, continues to be heard, and we need to keep the conversations going. And states like this here that really highlights the issues being faced by family carers, so we need to really kind of keep that at the forefront. And, you know, caregiving is going to affect everyone at some stage. If we haven't been cared for in the past, we may be carers at the moment, we may be carers in the future, or we may be cared for. So it's very, very important. We're delighted from a UCD endpoint that Care Alliance Ireland has partnered with us for a second time in hosting this carers event. So we're hoping that in 2 years' time we'll be able to co-host another one. Care Alliance Ireland are also our collaborators on the Carewell project, which you would have heard of, and about our event that's happening on the 5th of December. So that's all I really had, apart from maybe a few thank yous to all of the speakers today, to the chairs, to the HRB for funding Care Alliance Ireland to host this event, and really to anyone that maybe that joined us on the live stream. And I think anyone in the room today would have felt the care within the room for family carers and supporting family carers. And I think if we steal the Mary's term and adopt the think care approach, I think we can't really go wrong. So thank you very much, and safe trip home, everybody.